Good afternoon, everyone, and welcome to the Client, Family, and Community Inclusion, Lived Experience, and Diversity Advisory Committee, also known as the CFC Committee. My name is Rachel Chambers, and I have the honor of serving as the chair of the committee, and I am joined by the Honorable Vice Chair, Myra Alvarez, serving as the Vice Chair of the committee, and as our Chair of the Commission as well, Honorable Chair. Before we begin, I'd like to ask Chris, I'm going to say it, I'm working on it, Chris Sanji. I'm sorry if I'm saying it wrong, to take a roll and to establish quorum.
Thank you, Commissioner Chambers. Please note that under the Bagley-Keene Open Meetings Act, committee members participating remotely must keep their camera on at all times and will be asked during roll call to disclose if they have any other adults over the age of 18 in the room with them during the meeting, as well as the nature of their relationship with these individuals. Committee member Admasu.
Present.
Committee member Ayala. And feel free to correct my pronunciations. Okay.
Present.
Committee member Chavez. Marking absent. Committee member Dura. Marking absent. Committee member Gantzweg. Marking absent. Committee member Gilmer. Marking absent. Committee member Kalyali. Marking absent. Committee member Kashinovsky.
Here.
Committee member McFetter. Marking absent. Committee member Novotny. Marking absent. Committee member Owen.
Present.
Committee member Robison.
Present.
Committee member Xiong. Marking absent. Committee member Zaldivar. Marking absent.
No, I'm here.
Okay, thank you.
You. Had to find the audio button.
Yes, it happens. Committee Vice Chair Alvarez.
Present.
Committee Chair Chambers.
Present.
I'm only showing 8. Who am I missing? Oh, yes. Committee member Gantzweg. Okay. Okay. And I just wanted to confirm from everyone that responded virtually, nobody is in the room with you. Please identify if you have somebody in the room with you over the age of 18. Okay. Yeah. Is anyone able to unmute Gansweg? I'm showing mute on our end.
I'll try to, it only allows me to ask to unmute, but
Okay.
I see committee member.
Oh, not muted now.
Well, they were on camera and they came off, so I don't know if that, and then it looks like they're trying to unmute. Or
Yeah, I don't see the mute anymore. I just need to confirm nobody is in the room with them. Maybe if turn camera on and thumbs up.
Eugene just joined, and that would make us be at quorum.
Okay. Okay.
Committee member Dura.
Okay. Committee member Dura.
Present.
All right. We now have 9 confirmed committee members present, so quorum is established. Thank you.
once again, thank you so much for your time and the committee for coming together and the commitment to meet. I want to please note under the Bagley-Keene Open Meetings Act, Committee members participating remotely must keep their cameras on at all times and will be asked during roll call, which I probably should have said, to disclose if there are any adults over the age of 18 in the room with them in the meeting, as well as the nature of the relationship with these individuals. So we'd already did that and you confirmed. So thank you. So then if it's okay, I'll move to agenda item number 2, which is announcements. All right. Before we begin, as a reminder, we will be once again abiding to Badley-King laws for the meetings. However, as a part of commitment to deeper public involvement and open governance, all committee meetings feature an enhanced public comment segment designed to promote genuine dialogue between committee and community. Now let's go to the announcements. And I just really want to promote that. Like, I really want me to be quiet as much and really to listen as much and to get as much on public record of your feedback. So really, I'm trying to attend to that. So now going on to public announcements. If you missed, the Commission's Budget and Fiscal Advisory Committee and Program Advisory Committee and the Legislative and External Affairs Committee met last Monday, December 15th. Well, that was not, it was this Monday, December 15th, and then Tuesday, December 16th. You can access those recordings on our website. And also, as a reminder, the CFC committee was created, merging of the CC committee and the CFLC committees with the intent of meeting a total of 3 times. And since today, this is the 2nd meeting, and we'll meet one more additional time in February before returning to the full commission, which we will then determine whether we continue or modify this joint structure. So just want to let folks know why, if they're just joining, or like what happened or why we're here. I believe there's power in numbers. So really want to get that. And then lastly, the full commission plans to have a 2-day commission meeting. I don't know if it's set. The commission can let me know, or the chair or the staff, for January 22nd and the 23rd in Sacramento. For more information on these items, please visit our website or sign up for our email distribution list. And this concludes our announcements this afternoon. Is that correct are we set on the commission meeting dates, the 2-day meetings? I don't want to announce the wrong dates.
Yes, we are.
Okay, thank you. All right, agenda item number 3, general public comment. Amariani, please lead us into public comment.
Thank you, Chair. If you'd like live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the Chair so that we can be mindful. You may request to make public comment by submitting a card, clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. Members of the public can also email us public comment to be shared at a future meeting at publiccomment@bhsoac.ca.gov. We currently have one public comment. Our first comment is from Stacy. Your line is open.
Good afternoon, Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. I really want to thank the committee members for showing up at such a busy time during the holidays, and just really want to acknowledge that you're taking time. Means a lot. There's just a couple things I have for suggestions. I know, I can't remember why, but there is not a chat open, and I don't know if there are rules against that, but having a chat really allows people to communicate both with each other, but also with the commission when you can't raise your hand or it's not that time. I was just at the BHT Partners Forum, and they had an open chat, and I think anybody that attended that meeting would tell you that it was not disruptive. It was actually very helpful. and again, that's just a suggestion. The other suggestion is if there was some way online on the website where the committee members could talk about their, who they represent or what communities. I was going to say maybe when they introduce themselves, but you take roll call, so but I think if you want people to feel that their voices are heard or that they're represented, I think it would be great to have people say, and I'm sure that all of the people on this committee, I bet, represent more than one community. And it's just, and I don't want to also go by just what you look like, because just because I'm with the Asian community, I happen to be Asian, I don't feel comfortable speaking on behalf of the entire Asian Pacific Islander community, right? But I might say some Asian communities, that kind of thing. And we don't know, right, who's a family member or who's a consumer or whatever. And if this committee is going forward, I think if it would make people feel better if they would know who they could count on or who they might meet with privately outside the committee to raise concerns. So just some suggestions, and good luck on the meeting. I will be here. Thank you.
Well, wow. I mean, I like those suggestions, and I wonder, I don't want to get too far on time. I wonder if the commission could give a quick response on like what we could do relative to the chat, because I really like that as well. And then if we have a second for the committee members to introduce themselves and the community they represent, and then we bring back also a way in which we can communicate with the committee on how we best can support their work with interaction with the public. I mean, can we after public comment? I wonder if we can do that. I don't want to disrupt public comment as well, because Jerry has, I don't know.
Hi, Commissioner Chambers. We were advised by our legal folks that the chat can actually violate some of the Bagley Keene things because not all public members have access to the chat or can see what's being put in the chat. So it kind of doesn't allow the same process to all like public members. So we haven't enabled the chat. And then also there's no I guess it's hard for the transcriptionist to capture what's in the chat as well. So if they're not capturing those comments, then that's not also showing the transparency of the comments received during the meeting. We could, I guess, work with our legal team to see if there is a way that can be done, maybe.
Yeah, I wonder if we can think through that and bring that back even to the commission so that it doesn't wait until February. That would be great. Yeah, I think it's an innovation that we should think about. And then also, what do we think about? And I don't know if Jerry if yours a public comment, but about folks introducing themselves, just because we were a joint committee, and I think we should continue to remind which sections we represent, if that's okay. So I don't know relative to legal how I can, when we could do that. Is it after Jerry's, our last public comment, or?
I would need to confer with Sandra on it, as she had made the ruling before. So I would need to discuss it with her to figure out a way forward.
Well, not on the technology, on us just introducing her. I think I can just do that. All right. How about we take Jerry's, we finish out the public comment, and then I'll just make the statement relative to folks introducing themselves. Go ahead, Mariani.
Okay. Next we have Jerry. Your line is open.
Hi, everybody. Thank you, Chair Chambers, and thank you, community members as well, for showing up for the holidays or during the holidays. I only raised my hand because I want to support what Stacy had mentioned, is that the chat is important to the participants, the other 30 or 40 people that are here. And it's a way for us to share information with each other. And I believe any conflict with the commission would be, that you can't really take public comment during the meeting, during off times, when public comment isn't allowed. But commission members could basically commit to, keeping their eyes off the chat and just focusing on the meeting, and let the participants chat themselves. Also, you gave well, Stacy had also mentioned the chat record, and the staff mentioned the chat record. And it turns out that in Zoom and Teams, you're allowed to save the chat, and you could save the chat as the commission and publish the chat with the meeting recording and or minutes. And the idea being that if there's difficulty for people participating in the chat, they could come later and see the chat, and see the dialogue and see the links that are in the chat and be able to use those. So rather than exclude us all from the chat, why not work on solutions that allow us to chat, allow us to share the chat? It might be a little later, but I think the bigger picture here is that a more engaged community is a better commission of behavioral health. And so one last thing is that you gave a perfect example of when public comment is made. Usually boards just zip it and they don't give any feedback, and because you're not allowed to in the Brown Act law. But the chair is allowed to refer the issue to staff or other commission members for further pursuance, what have you. So rather than just go silent during public comment, the staff or the chair is allowed to refer the issue for further follow-up. And I really encourage that, because when we come and give a public comment, it's really the only 2 minutes we get to speak during the whole meeting. And it's really frustrating to try and cram everything in 2 minutes, and we're giving quality feedback, we think. So if the chair thinks so too, I just encourage you to continue that practice of following up with it and responding at a different meeting. Thank you very much. Happy holidays.
Thank you so much, Jerry. And I appreciate the solutions, because I'm not trying to just reinvent the wheel. I'm really trying to do something that, adheres to the law, but creates for true dialogue. And I want to do right by the public. Mariana, can you let me know if that's the last public comment, so that we can very quickly introduce where where folks are representing, and then we could get to agenda item number 4?
Yes, that was our last public comment. And then also, just for note, if some folks maybe don't catch this portion of the meeting or don't hear full introductions, all committee members, organizations, and their titles are posted on our website under the CFC committee, so they can also be found there.
Thank you. And for that reference, I'm like, I know I saw it somewhere. But can the committee members just give like 30 seconds, like literally, for us to stay on time? I really just want to honor this, because we're a new committee as well. Can you just give a 30 seconds of who you are and what you represent? Mariani can call the people who are present. That would help it go faster. Or legal team, someone to help us, or people can chime in.
Yes, 1 second. Hold on. Let's see how to do this. Maybe if each person just wants to take a turn unmuting themselves and introducing, we can start with you, Chair and Vice Chair, just to kind of get it going.
That's right, Mariana. You're so great. Look at you telling me to take leadership. I'm Rachel Chambers. I represent client and consumers. I am a client of a mental health system, and I am a family member of an individual living with a severe mental illness. And I also run and co-founded a company called Painted Brain that focuses on forensic mental health treatment with the provision of peer support specialists and a whole bunch of other stuff. And I'm an advocate for everybody in this community. Thank you. And I'll pass it to the honorable chair, who I look up to, well, the commission, and the vice chair in this role. She likes it when I just, like, she's so
Right back at you, sister. Hi, everybody. Myra Alvarez. My pronouns are she, her, and ella. and I serve as vice chair alongside the Honorable Chair Chambers. And my day job is I run the Children's Partnership. We're an advocacy organization focused on child health equity, and we take a really broad approach to what constitutes child health, including healthcare access and coverage, but also enabling the community conditions that we need for children to thrive. And part of that is addressing economic security that causes stress on families. It means putting food on the table that causes stress for families. It means paying affordable rent and housing, which causes stress and which leads to too many mental health challenges and crises for families. I am a family member of people living with mental illness. I am a huge proponent for ensuring we can broaden the conversation around mental health and the supports that our communities need in order to take a more public health approach to preventing the crises that we know are hitting so many of our families so hard. I am honored to be in this community with you. We've been in this work a long time together. So thank you.
I just got chills. Thank you. I see when I'm so thankful to Stacy to like just even learning more. Okay, the next person. Let's just go. This is great. I gotta call out. Come on, I gotta call out the committee member.
I got you. I
Thank
got
you,
you.
Eugene. I was gonna call you anyway.
Well, so my name is Eugene Duraw. I am a mental health services manager here with Solano County Behavioral Health. I serve in a couple of roles here as our BHSA coordinator, our ethnic services manager. I also have lived experience of family members who have navigated, specialty mental health services in LA County specifically, and just passionate about really my whole career has been centered around supporting those who are underserved and underrepresented. And so that's a little bit about me, and I'll pass it over to another committee member. I see Robin is next to me.
Robin,
okay.
Go ahead. We got like 20 seconds per person. Come on, we gotta go. How great you guys are. Go, Robin's great. Come on, Robin.
All right. Hi, I'm Robin Gaswig. My pronouns are she, her. My dog's in the background there barking, so he's in the room. Actually, I'm with Disability Rights California's peer self-advocacy program. I'm a person with lived experience. And also I'm part of a coalition, a peer coalition called Peers Advocating for Rights and Recovery. Thank you.
All right. A couple more members and then I don't want to get us off time. Go ahead, Carolina.
I'll go. Hola, my name is Carolina Ayala, founder and executive director of the Happier Life Project. My pronouns are she, her, and ella. I am a person with lived experience in recovery from mental health, substance use, and formerly incarcerated. I am a consumer and a family member as well. Thank you.
Thank you. That was great and concise. That was great. Jason? No.
Yeah, sorry. Hi, Jason Robinson. I'm a person with lived experience. I'm a family member. I'm also the chief program officer for a peer-run organization in Los Angeles County, and I'm on the board of directors of the California Association of Mental Health Peer-Run Organizations. So I'm here to advocate for families, people with lived experience, and for peer services and a recovery-oriented system of care.
That's great. Oh my, okay. I'll take one or two more folks that want to go.
Hi, my name is Sanai. I'm from LA. I'm the African Coalition or African Communities Public Health Coalition. Executive Director. I represent the diaspora communities and I also sit at the subcommittee at LA County Department of Mental Health, Black and African Heritage Subcommittee. And I'm also a registered member of LA County Department of Mental Health CPT, that's Community Planning Team, which we serve the same way we input community's voice. So I'm here on behalf of all the subgroups. Thank you.
Good afternoon. Richard Zaldivar. I'm the executive director and the founder of the Wall Las Memorias here in Los Angeles. We build an AIDS monument to people who passed away from AIDS. We provide mental health prevention services, HIV, substance use, and work in the area of tobacco cessation. I am a person with lived experience. I'm also a recovering alcoholic. I'm Hispanic or Latino, and I'm gay. Thank you.
Richard, I love your work, everyone's work. All right, I know, did we miss anybody? No, Larsa? Okay.
Got a few seconds
Richard?
for me?
Yeah, I was like, I don't want to call you out, Richard.
Okay. I was waiting for you to call me out. My name is Richard Krzyżanowski. I'm the president of the California Association of Mental Health Patients' Rights Advocates, also the vice chair of the Patients' Rights Committee of the Behavioral Health Planning Council, and I'm on the board of the Depression and Bipolar Support Alliance in Orange County as well.
Thank you.
And I'm up here, person with lived experience. Thank you.
Thank you. Larsa, did you want to go or no?
In the interest of time, we can.
Okay. Okay. We'll just keep going. Okay. So right now we just want to go to item number 4, which is the approval of the September 25th committee meeting minutes. At this time, we'll invite committee members to offer comments or ask questions. Are there any questions or comments about the minutes? Seeing none, now we'll see if the public has any comments. Mariani, please go ahead.
There are no public comment for the minutes.
Thank you, Mariani. Now that public comment is closed, I'd like to entertain a motion that the Client, Family, and Community Inclusion, Lived Experience, and Diversity Advisory Committee approve the September 25th, 2025 CFC committee meeting minutes. Was there a meeting? Is there a committee member to put a motion?
Aye.
Eugene, Eugene, is there a second?
Aye.
Thank you. Committee member Owens. Now that we have a second to approve the September minutes, are there any additional questions or comments from the committee members? Seeing no comments from the committee members, Krisanji, can you please call for the roll? I'm sorry if I'm messing up your name. We'll get it right soon.
Committee member Admasu.
Aye, I'm sorry. It's the mute.
Committee member Ayala.
Aye.
Committee member Chavez. Marking absent. Committee member Dura. Committee member Dura.
I'm sorry, I was trying to get off mute.
No worries. Committee member Gantzweg.
Aye.
Committee member Gilmer. Marking absent. Committee member Kayali. Marking absent. Committee member Kachanowski.
Abstain.
Okay. Committee member McFetter. Marking absent. Committee member Novotny. Marking absent. Committee member Owen.
Yes.
Committee member Robertson.
Aye.
Committee member Xiong. Marking absent. Committee member Zaldivar.
Aye.
Committee Vice Chair Alvarez.
Aye.
Committee Chair Chambers.
Aye.
The motion passes.
Thank you. And let's move to the next agenda item. And I think we're almost back on track. So that's great. We haven't missed any time. Agenda item number 5 is the Innovation Partnership Fund update. This is an update, also known as the IPF. During the last CFC committee meeting, the commission staff presented on the IPF Framework 3.0 and heard an overview of findings from the public listening sessions that were held in August and September. Today, we will hear an update on the upcoming release of the requests for proposals, RFPs, process for the Innovation Partnership Fund grant. The committee will vote to move forward to the full commission the outline for the Innovation Partnership Fund. At this time, I'd like to invite Dr. Melissa Martin Marlard, Assistant Deputy Director of Research Evaluation and Programs, to present the update, or a staff on the fund.
Thank you so much.
Sorry, Melissa. I couldn't see. I didn't know. I wanted to respect you. I was like, or a staff. Thank you, Doctor.
Thank you so much. It's my pleasure to be able to present on the Innovation Partnership Fund outline. We had presented this item on Monday at the Program Advisory Committee and got some really great feedback, but I'm very excited to be able to present to this group and hear your thoughts and input and suggestions.
Doctor, real quick, does folks know how to, because we learned this in the last committee. Okay, there it goes. I was like, do folks know, because it wasn't sharing. Okay, now it's gone. Sorry, thank you.
Okay, great. Oops. Sorry, I'm jumping ahead here. Okay, and I'm really going to try to go through my slides relatively quickly. Some of this information may be repetitive for some of you, but just to provide some context and give a sense of where our efforts have been grounded. But I really want to make sure to leave time for committee and public discussion. So just again to ground us in our efforts to date, for the past several months, we have done extensive engagement and analysis, and that has included an initial call for concepts back in the early spring of this year. We've held 3 listening sessions, one that was focused with this group. We've held 3 program advisory committee or PAC meetings. Apologies, I'm getting a little, and then this group convened and we presented our initial framework to this group and got input. I think there was overlap in the committee member participants and those who attended our listening session focused on lived experience. We have presented this item at 3 full commission meetings, have been in conversations and discussion with state agency partners, and have done our own internal analysis of the BHSA statute and the ways that IPF is nested within that. So on November 20th at the full commission meeting, our framework version 4.0 was approved and adopted. And our plan is to release the RFP in winter of 2026. Again, after getting feedback from you all today and continuing to incorporate that feedback into our actual RFP outline. Okay, so I'm going to walk us through first some of the items and cross-cutting elements that are in the framework that we will need to make sure are embedded in the RFP itself. So we're going to, in the RFP, have language that specifies that all applications must meet the following components. So applications will need to meet and demonstrate meeting the definition of innovation. They will need to address the needs of target populations and be able to convey how that those needs will be addressed. And they will need to apply to and support county programs in the ways in which they are implementing BHSA. So again, these are mandatory components that we made certain to embed in the framework, and again, we'll be making sure to carry that thread through to our RFP itself. Let me switch to the next slide. The applications will also need to convey, and these next 5 items are some of the cross-cutting elements that stakeholders and others have identified as important. So the applications will convey and in fact will be scored on the extent to which they increase equity, reduce disparities, and ensure innovation projects served underserved populations and those most in need. We are going to be looking for applications that involve community input and lived experience in the project design, in the implementation and evaluation. So kind of through that whole project life cycle. Be financially sustainable beyond the life of the grant. Excuse me. And with this item, we have definitely heard from members of the public and others that, and we very much understand that Medi-Cal is not the only viable path to sustainability, but we also recognize that because of the Commission's limited funds, direct support from the Commission is not a path to sustainability either. So we're looking for projects that are able to take the kind of startup funds that the Innovation Partnership Fund provides, and then depending on what the project is and who the partners are, to convey how that project will be sustained beyond the grant. And then fifth, that proposals will leverage data to identify what's working and what to improve. And then finally, that applications will align with statewide behavioral health transformation efforts. A couple of last things that we will be asking applicants to indicate are whether they are including community-centered solutions, which do include community-defined evidence practices, whether there are any emerging technologies that are to be leveraged, and lastly, whether the projects advance any effective treatment models. So these are applications do not need to include all of these, but these are some of the things we're going to be asking specifically about and looking for and scoring around. Okay, so I'm going to switch to, oh, that's a very bright pink. It's green on my handout.
The last committee meeting.
Yeah. It got switched to a very bright pink. So hopefully people can read that okay. So the next couple of slides really focus on summarizing the feedback we have already received through our engagement efforts. We tracked them. We, up until this week, we had really been trying to focus on receiving input on the framework itself. But of course, people had really wonderful suggestions about the nuts and bolts of the RFP. And so we kept track of that, and hopefully the next few slides provide a thorough and adequate summary of that nuts and bolts feedback we've heard. So around eligibility and scoring, we have gotten feedback that projects must not duplicate existing efforts, that we, the Commission, must ensure that there's no conflict of interest with commissioners, that we've gotten some mixed feedback on which entity should be the lead proposal and receive priority points. Some members of the public and stakeholders have indicated that they want CBOs to be the lead, while others have indicated that CBOs should not actually be given priority over other types, such as public agencies or private for-profit agencies. That awards should prioritize equity, lived experience, and community leadership as a scoring criteria, and that there should be some additional clarification around, and this is in the IPF language and the statute itself, that other populations as determined by the CBH, that we should clarify whether we're identifying other populations. So you can see on the right side of the table that for most of these items, they are either currently under consideration, meaning we are moving in that direction, but just making sure that we are aligned with best practices for procurement and that we're staying in the legal parameters for competitive and procurement processes. With some of these others, like the second one around conflict of interest, this is already addressed with existing conflict of interest laws and waivers that commissioners are required to complete. For this third one, where there is this kind of, where we've gotten mixed input, we are considering, and one of the things we'd like to get feedback today on is carving out a small grant tier that requires that the grantee be a CBO, a nonprofit entity, or a tribal organization. And that does not preclude these types from applying for the large grant component, but we are, trying to think through whether carving out, and we did get feedback from Mental Health for America, I believe, who indicated that sometimes grassroots organizations really just need a small grant award in order to do really transformational things. So this is one of the areas that I definitely want to get feedback from you today. Just continuing still around the nuts and bolts and what we've heard around eligibility and scoring. We've definitely heard that eligibility should not be limited to serving those individuals with a diagnosis. And we absolutely agree. The definition and what we know is allowable in IPF under BHSA will not require that a diagnosis be there. So that's, I think, going to be very clearly addressed in the RFP language. That we've also heard that projects aimed at BIPOC and LGBTQ plus communities should be specifically prioritized. The Commission and staff believe that these communities are already encompassed in the population priorities within the IPF framework, where it talks about underserved populations, low-income populations, communities impacted by other behavioral health disparities, and again, this more ambiguous language of other populations as determined by the CBH. And then lastly on this slide, that we've gotten feedback that we should use IPF funding to sustain and expand the California Reducing Disparities Project, and just clarifying that all projects that meet eligibility outlined in the IPF RFP may apply. All right. For research, data, and learning, we got some feedback around this kind of bucket. So that the IPF should incorporate a shared learning component so impact is maximized for the broader public. And we plan to assess and document learnings, and where appropriate, publish those learnings for public knowledge along the way. And then, of course, at the end of the 5 years, the Commission is actually required to write a kind of final summative evaluation report on IPF. That grants should be data-driven and have clear data collection and reporting requirements, which we agree with and are absolutely considering how to incorporate that and make that really explicit in the RFP. And then lastly here, that grants should specify how investments will be measured, tracked, and evaluated to ensure goals are met. So again, really great feedback, really, I think all driving towards a continuous quality improvement kind of model, and really looking at understanding as the grants are going and as the projects are implemented, what's working, where there may need to be some adjustments in order to be most effective for the communities and systems being served. Okay, and then lastly, for just summarizing the feedback we've already received on the nuts and bolts, we did get a couple of suggestions around funding itself. So this is kind of related to that small grant carve-out, that the funding should be tiered to meet the needs of applicants of different scales. So again, we're considering that small grant tier carve-out. We did also get a suggestion around requiring match funding or matching funds or another way to ensure outside support. And this was, when we considered this one, we like the idea of it encouraging kind of collaboration between partners and that it, gestures towards sustainability. However, we felt like this requirement might preclude applications from CBOs, grassroots organizations, or others who may not be able to secure matching funds at the point of applying. So while we're still absolutely incorporating a sustainability requirement, we are not planning on requiring this matching fund component at this time. Okay, so I know that was a lot of, I said I was going to try to go quickly, and I don't feel like I went as quickly as I wanted, but hopefully that grounds us all in sort of the work that's happened, the feedback we've received, how we've really tried to listen and incorporate the suggestions and input that we've received to date into our current thinking and the RFP kind of outline that we've got to date. So to help kind of guide us, offer some suggestions of where we feel like your input and suggestions would be most helpful, we generated just a few questions, but we want it to really be an open dialogue, and we encourage questions or input that may not necessarily fit within these questions that we developed. But a couple things that would be helpful to get input around is, this idea of the small grant carve out. What are your thoughts for whether that's a good idea, how that might be structured? Are there other ideas that we should consider around tiers or having carve outs? Should we have minimum and maximum grant amounts? And if so, what could that look like? How should the commission best assess potential for sustainability in the application process? Again, really understanding that Medi-Cal is not the only pathway and may not be the most appropriate pathway for certain applicants or projects. What does success look like, and what metrics should the commission use to measure this? How do we ensure grantees have the capability to accurately and successfully collect, track, and apply data to ensure continuous improvement? And then, again, open-ended question, what else? What did we miss? What are we maybe not addressing sufficiently, or just haven't kind of considered that you'd like to bring to our attention? So with that, I will turn it back over to Chair Chambers and see if there are questions from the committee.
Thank you, Melissa. At this time, I'd like to invite committee members to offer comments or ask questions. We'll keep, I don't know if we want to keep the slide up or just, go in. Now that we have the floor open, wait, no, we're going to go to Jason first, sorry.
Go ahead.
Yeah.
Yes. Okay. Well, thank you. I guess it's well, I have concerns about the carve out for smaller tier grants for a subsection of applications. And I worry that that's going to kind of ipso facto push smaller organizations into smaller grants when they might need bigger grants to be effective. Like if my organization is going to do something, the cost of supporting a staff person in Los Angeles is upwards of $80,000, all things considered. So to work substantially on any given project requires investment. Another idea would be to score organizations that are either tribal organizations, community-based organizations, peer-run organizations with specific, whether it's 10 points or not, right? Then that organization gets 10 points in the scoring of the overall grant rather than carving something out. It could be a both and. I guess my question about outcomes is what's the overall goal of the program as a whole? Is it to better connect people to community, better to support people? I think some real guidance around what the commission's trying to do with this program is going to help inform how we want to measure it. I mean, I think the three important measures that I would consider right off the bat are people satisfied with the service that they're receiving? Are their needs being met? I guess those two would be the start. So thanks.
Thank you. Was
Can
there
I
any
just
other-
Oh, sorry, Commissioner Chambers. Can I just clarify quickly that if we were to do a small grant carve out, that would not preclude CBOs, tribal organizations, or grassroots agencies from asking for the large grants? So it would, not be you're only limited to the small grant component if you're a CBO.
That's clear. I'm trying to help them to be competitive for a larger grant.
I kind of see what Jason's talking about.
Because, for example, if there's a match requirement, a larger organization like mine is much more able to meet a match requirement. I've got 10 other government contracts that I can leverage as a match for whatever funding I get. But a small organization is less likely to be able to do that. So,
and that's exactly why we decided not to require a match for that very thinking that it could accidentally penalize small grassroots orgs who do not have 10 federal grants.
Yeah, I would encourage a scoring mechanism that helps small and tribal and peer-run organizations, community-based organizations score well against those that are not structured that way.
And I just want to echo that it's just in general as someone that's still like a small but like working their way up. But I want to say, just to add, is that Medi-Cal isn't the option, but a lot of our folks are served, under the Medi-Cal system. So how do we create a system that meets the gap? For me, it's like, and their feedback, like, how do we create innovative strategies that meets the population that are most vulnerable, but that we can find sustainable ways? Like, if we're giving grants to folks, like, we want them to be sustainable, even in that transformation. Like the organization needs something small or just to do a transformational thing. How is that going to integrate into a county system or to a managed care plan to sustain the work? So I just think in general, like Jason, to your point of being sensitive and being a grantee of like PWI and EPIC grants and all that stuff, it's like making sure, everything you said, but that people can be sustainable. I think that's the biggest thing. And I don't know if there was any other committee members that had any comments.
Hi, this is Carolina Ayala. So I echo what was brought up around the separation a little bit. I did hear saying that it's like a smaller org can apply for that aspect of the funding as well as the larger aspect of the funding, and that it's not going to, one is not going to keep them from the other. Just curious about, the qualifications then to apply for the larger, right? And where do they meet that? And so I would perhaps propose something that rather than separating large and small organizations, I'd encourage the commission to consider investing in shared infrastructure that all eligible organizations can access. through perhaps like outcome measurement training, community needs assessment support, cultural responsive evaluation tools. If that pocket of money is being used to say for the small, instead using it as shared resources, shared infrastructure that all can actually utilize from with that funding. That way we're not selecting, pre-existing capacity, but actively building it across the system, which ultimately strengthens accountability, equity, and impact for everyone.
I think that's awesome because a lot like the shared knowledge is also like better than the money sometimes. And right now, I mean, if we're supporting folks to smaller organizations to be big and to be bold, they're going to need to have shared equity. We're going to need like that's so I really appreciate that. And if we can echo that ecosystem of building the ecosystem, like we need each other, right? So thank you. And to the next committee member, Owen. Or I don't know if Melissa, you had anything to say, but go ahead.
Nope, just taking notes.
Got you.
Is Josephina? I'm sorry, I don't want to step in line.
I don't know. Is Josephina? I'm sorry. Was that? I'm sorry. I'm looking at the right.
I could be wrong.
What?
I saw her hand raised.
Committee member. Oh, sorry, Josephina. Are you? Yeah, I was. So I didn't want to disrespect Josephina, but with this section is for committee members.
Understood. Didn't want to,
No, you're amazing. Look, this is the community. This is why you're a committee member. This is why there you go.
I'm sort of doubling down on what Jason and Carolina said. I agree completely. I think the small grant is hard. We're a micro business. We're a service disabled veteran-owned business. And most other California agencies offer incentives for that partnership because often they have that lived experience, right? Those smaller businesses that are in the community that get to partner maybe with, the larger CBOs that always score better. We can't compete, so we can only ask to be in partnership. And that partnership could be scoring preferences. And that's many California agencies have that scoring preferences for micro businesses and minority-owned, women-owned, that kind of thing. But I think, I mean, we're talking about the core of this is like a systemic difference, right, in the way that opportunities are provided. So incumbents score better. So we don't get fresh, new lived experience that maybe had more recent understanding of the community. And I think, or even more recent understanding of interventions. And I think we have to, I mean, the scoring is difficult in that experience. So we couldn't qualify for a small grant, so we would ask for a partnership. We can't qualify for a large grant, we would ask for a partnership. You get more bang for your buck when you're bringing along other California-based lived experience knowledge to partner with you on these grant opportunities.
Thank you. I appreciate that because that's really what I've been echoing. And Melissa's taking notes. I don't know if Sanait was next. I know Carolyn, your hand's back up, but I want to.
No.
Oh, okay. I don't know how to lower your hands. If Mariani can help with that, thank you. Go ahead, committee member.
Me, Sanait?
Yes.
Oh, hi. I just want a quick question. I think it's a great opportunity, especially during this time, like a lot of service providers, nonprofit, any other agencies suffering because it's a lot of other, whether federal, state, even county level shifted. And a lot of grants has been stopped and we surviving. Yet the consumer, the community we serve, they don't know about fund, whether we have or not. They're expecting more service, more so is very traumatic experience right now. Things have changed. The social factors, all that is increasing the mental health issue, including homelessness. I'm saying that I'm not sure if it is partner with the county level or is this direct the state grant. If it is partner with county, I think county has already reduced, eliminate so many funds. It would be great to work this innovation parallel to those grants. The reason I'm referring those grants was really design, the amount and the outcome expectation, the measurement tools, all that already there. But those grants are gone. At least what I know, for LA County, I sit with CPT. We hear a lot of changes going through this behavioral change, systemic. So I would say, because, and also we are organized under underserved communities in different level. I think it would be a great idea to learn something because each county has different own way or of strategy to use it because of the population, because of diversity, all that matters. I would say it's the best partnership would be different counties to see what has been working in the past and what is going to be working in the future rather than just innovation is great, but we can always adapt what we have worked in the past and be able to replace what we lost.
Thank you, Snite. I just really want to uplift for like calling it out. Like there's cuts right now. Like people, and not to say that the commission can save everything and or the counties, but like and the community are like we've every organization that we know like has gotten cuts and people are asking for more help, not even understanding how to even navigate their Medi-Cal benefits or are underserved with the benefits. And us as ethnic communities are no matter what, and API, everybody, African, like every cultural specific, there's still ethnic communities are probably leaning more on our cultural specific resources because of things. So if we can, so I think that we'll be able to complement that. So Jason, I hope we can. I hope this innovation fund. I know we have you as a committee member and then Carolina, and then I'll wrap it up to get to the public.
Thanks. I think Eugene had his hand physically.
Oh, did you? Oh, I'm sorry, Eugene. Well, then you want to go first?
Yeah,
I'm sorry.
been no, it's okay. I appreciate it. I just earlier just wanted to just echo the statements that were shared around the TA type like support that could be provided to grantees. I think that is something that I think could be really beneficial. So I just wanted to echo that point. We actually are implementing relatively smaller community grants here in Solano through a partnership with Cal Mesa, centered around May is Mental Health Month events, and it's probably on a lower scale, but it is something that we're thinking of, making sure that it's open-ended in terms of like grassroots organizations can apply and or CBO partners that are already established, just as Jason was kind of alluding to, and to be able to provide more of those opportunities to be able to reach the folks who essentially we're striving to do so in terms of our county efforts. And so I just think that will be really beneficial, especially around the piece around data collection and or just how to put forth just great evidence-based or community-defined practices that can really help support and render the results that we're looking for. So if there is something that could be embedded with that, I think I would lean towards that as much as possible.
Thank you. And I am interested to see, like, and maybe off at another topic, like, or to follow up with you on like how counties are strategically using those funds to like support the full system of care. But I would like to get more because I'm interested in that. Jason, do you want to go and then
Sure.
go ahead.
Yeah, thank you. and I appreciate everybody's input. I have maybe one suggestion and then a question, and based on the answer to the question, it could be a whole can of worms. I apologize in advance. But the potential suggestion is if we're going to have, target-based populations, there could be a way to look specifically at prioritized scoring for staffing patterns or organizations that have the same demographic as the target population. Right? So organizations that are run by the people that they're intending to serve, things like that. I think that would be important. Then the question is, because I'm still thinking about the funding sustainability, and in your work with the commission, when you put this together, because that's typically something that would come from like a foundation. When a foundation gives money, they look for the viability of ongoing support. So where do you see in this context viability for ongoing funding for the kinds of projects that you're looking to uplift here?
I don't know if that's for Melissa, but I mean, I think the system has been speaking to that in general. I mean, in alignment with BHSA, right? I mean, I would love the doctor to chime in, but I mean, if we're adhering to the law and aligning with the BHSA, I would think like we would be looking at other sources, but to integrate in the system would be the goal, and to improve the system would mean that whereby this is just a logic. This is not saying I hope somebody would correct me or explain it because I don't know. But I'm saying we would need to like integrate, then that would be thus like Medi-Cal mixed sources of funding, which people are saying Medi-Cal isn't the only answer, or ECM would be another, the whole other managed care plan is what the commission is also looking at as well as like those other benefits but this is for other populations. I don't know, Melissa, do you want to chime in, or Brenda?
No,
Because I don't have the answer.
Yeah, I totally agree with you. I don't have a better answer than that. I think your point about the goal with sustainability really is integration with the system, whatever that looks like in terms of sustainability, whether it is some sort of Medi-Cal reimbursement, whether it's connection to the managed care plans, whether it's through commitments from local county dollars that are outside of BHSA or Medi-Cal. I mean, ongoing private foundation dollars aren't, I don't think, really a long-term sustainability strategy, but that's, another potential path. I think the point is we have $20 million a year for 5 years, hopefully. That money is not going to go that far, and we don't have any guarantee that we have anything beyond that 100 million. We don't even have a guarantee that we'll have the full 100 million. Hopefully we do, and hopefully we'll be able to demonstrate impact and learnings along the way. We're optimistic, but with that funding source scheduled to end in 5 years, we can't guarantee the commission. It's not financially possible for us to guarantee ongoing funding for the projects that we seed and start up through the Innovation Fund dollars.
Yeah, and to your point, I appreciate that explanation. And I think the biggest thing for me as an advocate, Jason, and to other folks on this call is like, how do we, with those learnings and those sharings, like this is our opportunity as the community to really show them that we can fill gaps, create innovation, and meet the needs. Like, so this is our best shot at like what we can do, right? Like this is our best, this is what we can do. And if this is the system that we're serving folks in, we got to put something together, and it's going to take us some coalition building and some innovation, but not with outside business people. And it's going to be a mix of everybody. So that's why I'm happy that we're having these dialogues. because this money isn't guaranteed, but what are we going, with all of our might, what can we bring to the legislator? What can we bring to the next governor? Like, what can we bring, like, to the learnings to the state that we can enhance what they're doing, and make it better, and make it culturally responsive, and make it more led by more opportunities, and demonstrate that people that look like us with our lived experience can do these programs. So I'm excited, and I'm excited to the expansion and to talk about the care plans and sustainability models. And I think that as we do learnings, we should be talking about these other benefits, and like, are people making money? Are they losing money? What are they doing? Like, and these are things that other CEOs and business people, like, a grant ain't gonna help you with that. Like, that's some talking and helping you do some budgeting and some modeling and helping people sustain so they can do this work will go far better than you giving somebody a grant. So I really appreciate that, Jason, and the question. And I think this is our opportunity, and it gets me excited to just be thought partners. And I hope we can demonstrate something. Go ahead, Carolina.
Thank you. I really appreciate the answer, Commissioner Chambers, and I think it's Melissa, right? Thank you very much. So that tells me that, what we're looking to do with these programs is kind of create long-term connection to the existing system, whether it's a county plan, whether it's BHSA, whether it's Medi-Cal, create things that can connect to that system and then kind of live on. And in that case, if that's the design and the plan, I think your statement about demonstrating impact is really important. And so when I think about impact, the thing I think about is one of the things that our system really lacks is flow, right? People get stuck in services and we can't develop self-sufficiency and flourishing in the community. So I think we want to demonstrate projects that impact the community by developing self-sufficiency, person-defined recovery, community, family reunification, and open up spaces in the programs. Like if I have a housing program, I don't want to serve the same 40 people every year. I want to have like 40 slots that get people into, living independently, so that 40 new people are moving into that housing every year of the 5 years. So that's what I would say.
Exactly to your point. I know, but Jason, and right now there are people that are stuck, that don't know how to even use their insurance, that fall on the county. Like, literally, we serve people that are at Painted Brain, my organization, that are underserved, that don't know how to navigate their resources and get stuck and don't know what's due. And then so that's just even a flow, right? That's an entry, that's an access. And if people need services now, they can't wait for their Medi-Cal like benefit to or their qualification. They need, if they get sexual assault, if they're like, we need people on the ground, right? So that's the other thing, like in that system of flow, that we really need to recognize that everybody's not going to fit directly into the Medi-Cal box. And then how do we maximize the Medi-Cal box and then be that barrier? People should have easier access to get into the system and know how to utilize the system. And then it shouldn't just fall on the counties, because everything does. I know that if all fails, we can go to the county. Okay, thank you. But go ahead, Carolina.
Thank you so much for the rich engagement. I do want to add to that it's like so important as we build this out and go over, like we were saying, like 5 years, right? Is proving the outcomes of the efficacy of true peer-run respites, what we reduce, what we avoid in costs, in deaths, in lawsuits, in ER visits, in jail bookings, and that we are tracking and documenting like all of this as part of the putting all of this together, and the funding that we're putting into this, that those are super measurable, very clear, because that's the story that we are that we're painting that we already know, trauma-informed voluntary alternatives, right, aligned with civil rights and dignity. And the thing that I see that has been an issue for our type of organization is you want to get to law enforcement, you want to get to ERs, you want to get to people that are intersecting with folks like those county teams that are responding, that, you know, send them to X, Y, Z, or however. And one of the issues that we have come across is that we don't have a MOU or there's no referral pathway. So they can't just call the Happier Life Project, right? They have to follow their chain or their protocol of who it is or whatever, because then there's like some type of, risk on their end if they're just like, call the Happier Life Project's Pure Respite, Crystal's place. Or so really working at like, those are the places and the spaces that we need to connect where people are already being, met, and then how do we build that so then we can actually have that information that is sharing, that's building the case for why this is actually something that continues to get funded as part of the larger system under crisis, under there's all these different buckets, even under the opioid response or the opioid settlement funds that's happening across the state, like in counties. That's an avenue and that's an aspect if we can show and prove that. So there's all of these different ways to approach other sources of funding. Like, let's follow other states that have gotten it from general operating, right? Where it has nothing to do with Medi-Cal. It has nothing to do with who's in office. It comes directly from their general gen ops. I think I'm saying that appropriately, but there's other ways that we need to invest to be able to find that out as we're doing this simultaneously.
Thank you. I appreciate that. And it's just so much that to unpack. And I wonder how we can like get this without taking so much time of you all to put it in writing. Yeah, because it's like the timing, like we got 2 more committee members. But we got your stuff. So how do we get Sanait and Richard's comments? And then we got to get to the public. But I don't want, this is a fruitful discussion. And I always feel like I'm like, I want to respond to Carol. I want to respond, but I won't. So I just
want it noted.
Yes, it's noted. It's noted. I'll just say noted. Real quick. So who was first? Was it Sanait or Richard? Or what? Richard hasn't went yet. So do you want to, or do you mind? And then you can go real quick tonight.
I don't mind. Go ahead, Richard. I'm just going to back up what I said before, but I would give Richard a chance before.
Okay, I appreciate you.
Thank you. I need a chance. And everything that all the factors people have expressed are so crucially important. And a few of you have kind of hinted at something, though, beyond just financial considerations, beyond just integrating well with counties and the systems out there. I think a few of you kind of hinted at the human factor, and in terms of sustainability, I think no matter what kind of, whether you're a CBO or a program of a larger organization, I think it's a strength, and I look for the connectivity that projects and organizations cultivate beyond the usual suspects. What other organizations, what other communities that may not seem to be as crucial a part of what you're doing, but who are you connected with? Who are you collaborating with? What coalitions are you willing to join that look at something wider and look at a broader sense of shared interests? And that's, I know, a very vague, very open door, but what friends and alliances are you making beyond just the folks that give you money or that are part of the larger official system? Because that's a real strength. And you get knowledge, you learn things that are maybe beyond where your thinking usually takes you. So I look for a broader sense of collaboration and alliance building and deeper connections to communities that may not even at the beginning seem to be a part of who you are. It's amazing what you find when you explore these relationships. So I hope that makes sense. I know it's kind of vague. but I just wanted to share that as best I could. Thank you.
It makes sense, and the connections, and I think it's hitting at what everybody's saying, a common theme. Like people are gonna need to connect and understand, even to what committee member Ayala was saying, like understanding like the other sources of like how these counties even get money or how we can advocate, and we're gonna need to share information. So go ahead, Sinait, and then I'll close it up to committee, and then we'll if the public can put their hands up in a minute, like now, so that we can get we'll probably put up like a timer so that we can get through to the respite, because I want you guys to get feedback on the respite too. Does that make sense?
I'm just going to be short. Like one of the good thing outcomes to me, at least in LA County, was MHSA come to 2004, 2005. One of the achievement I would say is be inclusive underserved community. In other words, like we are subgroup, I think Chamber, you might know this, under UCSS before, underserved community. We were under that. So every grassroots organization be able to practice their community defined practice, be able to reach out. To the point, under that program, there's a lot of us, a lot of community members who does not want to be in county under medical, because that's a stigma. They don't want to be registered their name if they use it. But however, with this funded program, we're able to reach out and reach communities. They could be just helped directly. Now, BHSA, I don't know what happened. That structure is gone. The fund is cut from that empowerment for underserved community. This is the kind of thing maybe we have to revisit why it happened. We advocate for the county, but the answer is like, this is a systemic change. This is the budget shift. I really like to learn a little bit more why it happened, while we increasing the awareness, we're decreasing the stigma through that programs. So if there is any innovation, we might have to look after those kind of program as well. Thank you so much for the opportunity.
I really appreciate that. And I think and please don't stop echoing and asking why, as we and uplifting the communities, as these services are allegedly going to be cut. Please continue to keep your voices like loud and to be heard, and let us know what's happening. Because if they don't see any difference, then we don't know, right? So we got to keep the voices. So Mariani, I'd like to open it up to you for the floor for public comment.
Okay, great. We have 7 public comments currently. Our first public comment is
Mariani, real quick, should we put a timer, or Brenda or Sandra, or how are we on time, or no? I don't like the buzzing. I don't like the timers. But I'm sorry, and you probably put a timer on me too. So.
Commissioner Chambers, yeah, we probably should put a timer up, just because if we got 7 comments, even if we're doing 2 minutes a comment, that's 14 minutes, and we still got pure respite to do before this ends at 4.
So should we do 1 minute? Is that and then
2 minutes? You want to just do 2 minutes for everybody?
Oh, 2 minutes? It's fine. I mean, 2 minutes, and okay.
So, I won't give much time for pure respite, but I don't know if that.
I think that both. Do we have more time with pure respite? I don't want to. All this stuff goes together, so I just want you guys to know. I know we're wasting time not talking, but all of it flows.
Okay, 1 minute. All right. I'm already saying let's just do 1 minute, try to get through, because we've had quite a bit of dialogue, and then we'll try to do pure respite. And we could do something that we did with PAC, where if we run out of time, folks can submit written comments maybe to the end of the year, and then we can gather everybody's information or thoughts, because we don't want to lose them.
All right, I appreciate you, because we got it. Okay, so go ahead, Mariani. Thank you.
All right, perfect. Our first comment is from Josefina. Your line is open.
Okay, thank you so much. I'm Josefina Alvarado Mena. I'm the CEO of Safe Passages, and I'm with the California Reducing Disparities Project. I know that the commission is thinking about how to potentially assess for sustainability during the grant process. And I think that there's another important question for the commission to consider, and that is, what is the commission's role in helping to sustain the programs that are funded through the IPF? The other area of comment that I wanted to make relates to the evaluation questions. And one of the major outcomes that is part of the BHSA is reducing disparities. And so this requires the development of an equity evaluation framework that we currently do not have. Part of that will require specific metrics to be developed to measure the reduction in disparities. And I think that should be incorporated into the evaluation framework. And then finally, grantees should be required to disaggregate the data by race, ethnicity, LGBTQ status, so that way reductions in disparities can actually be tracked. And this is a requirement of the BHSA of all of the funding sources. And then finally, there's language around the award should prioritize equity, lived experience, and community leadership as part of the scoring criteria. And equally as important is during the review process, reviewers should be brought to the table that have experience related to equity, lived experience, and community leadership. Without having the readers with that kind of
Josefina, if
experience,
you could wrap up, sorry.
not going to be able to assess for those criteria. Thank you.
Thank you, Josefina. And if you want to submit that what you read, which was great in writing, I'm so sorry to cut you off. Go ahead, Mariani.
Thank you. Our next comment is from Lupita. Your line is open. We cannot hear you if you're speaking.
Can you hear me?
Yes, we can hear you now.
Okay. Thank you. So in my comments are in regards to the feedback that is under consideration that states proposed projects must not duplicate existing efforts. I would like to make sure that projects that can be scaled or replicated are not disqualified. And I'll say my name is Lupita. I represent the Health Education Council, which has a pilot project under the CRDP. And I say this because projects that have proven to have a model that works and can be scaled and are replicated, maybe with a partner agency beyond their current site, and have the capability of serving many more people thanks to what they have learned in implementing it. And many times it takes a lot of time to ramp up a project, and it might not be fully developed. And this additional funds will really support in scaling it and serving more people. And I really feel strongly that they should not be disqualified and should be permitted. Thank you.
Thank you. And if like Chair said, if you had more to your comment, please submit it in writing. Our next comment is from Jerry. Your line is open.
Hi there. Thanks once again. I love this topic, and I encourage us to think about this. The innovation fund is a business would, and that is use it as seed funding to prove ideas, to fail fast, because what we want to do is spend the money where it works best, and spending grant money on opportunities that aren't really proven is to me foolish. And a business wouldn't do it, or they'd be out of business. So the idea is have a phase one where they prove the initial concepts. Data has to be included. It's stated it's data and KPIs are basically under consideration for inclusion. Those should be the first priorities. How are we going to measure the success of our money, and how are we going to quantify if it's working or not? And we can't just use data, we have to use qualitative data as well. And lastly is, and I'll put this in writing, but I really encourage us to consider organizations that have any type of social enterprise operations going, where they can show potential sustainability of their phase two to keep the project going longer. Because if they can show us sustainability, that just helps us extend our spending. So thank you.
Thank you. Our next comment is from Stacy. Your line is open.
Hi, Stacy Hiramoto, REMCO, the Racial and Ethnic Mental Health Disparities Coalition. I would first like to strongly support all the points that Josefina Alvarado mentioned. In the interest of time, I won't repeat those, but I do strongly support those. Number for my own, I would like to say that we strongly support CBOs being the lead in these projects because I believe it is more difficult for counties to design and implement innovative programs, not because they are inherently bad or ill-intended, but because government in general prefers solid clinical proof or long-term research that something is effective before funding. Government is usually risk averse because after all, the taxpayers are in general wary of funding something that cannot guarantee results or saving money. But innovation is not supposed to be a guarantee. A likelihood, of course, but not a guarantee. Regarding projects aimed at BIPOC and LGBTQ communities should be specifically prioritized. The reason that we say this is, yes, they are already covered under categories such as underserved communities, poor communities, others. But I will tell you, my experience at the local and state level, when talking about underserved communities, BIPOC and LGBTQ communities are often, go to the bottom of the line of those, and everybody says, oh, well, my group is also underserved. Literally, there were I could think of almost no group that said that they were underserved. Lastly, I just want to say the federal climate really is disproportionately harming BIPOC and LGBTQ communities. Thank you.
Thank you.
Thank you.
If you want to submit those, if they were rushed, I really appreciate them.
Thank you. Our next comment is from Danny. Your line's open.
Hello, can you hear me okay?
Yes.
Perfect. Awesome. Good afternoon, and thank you. My name is Danny Derrickle, Public Policy Coordinator with Mental Health America of California. I just want to first thank staff in there for their incorporation of the feedback and response slides. This has really addressed our previous concerns regarding meaningful engagement and transparency when it comes to public comment. So we thank you for the slides, and we hope to see this method used more often in future decision making. And then lastly, just to say that we also want to thank staff for the consideration of the small grant tier. Innovation does not necessarily mean large investment projects. We know that innovation can take many different forms and can be accomplished with just the modest of investments. And so a small grant carve-out would absolutely help protect some funding that could directly support those local and smaller CBOs and the work that they do. Again, thank you, and we look forward to continue working with the commission and staff.
Thanks, Danny. Our next comment is from Laurel. Your line is open.
Hello, it's Laurel Ben Hamida from Mass Social Services Foundation and REMCO. 2 questions linger from Monday. How long can a project be proposed for? It seems to me that it would be a bad idea to say that a project could only be proposed for 1 year without requiring and funding subsequent years or having some sort of pathway to do so, because this is supposed to be a transformational innovation, $100 million. And if you just chop it up into a lot of 1-year projects every year for 5 years, I don't see a transformation. I see business as usual. And my second strong suggestion would be a 20% for evaluations suggested.
Thank you, Laurel. Our next comment is from Monica. Your line is open.
Okay, now yes, it was a little hard. Okay, thank you. Good afternoon. Thank you for listening. My name is Monica Zúñiga Fajuri. I'm a psychologist working in a CBO in collaboration with 2 other CBOs regarding prevention early intervention. And I want to just join what Josefina and Stacy said and probably stress a little bit about equity. Equity cannot be just a mission statement. It must be shown in real action, how communities are involved. and who is making the decisions, who is hired, and how success is measured. I think this moment matters. Right now, at the federal level, we are seeing policies that harm BIPOC and LGBTQ communities, and California must do better. This is not federal money. California must stand up for our communities and be clear and specific about what equity really means. We are not asking to block anyone from applying. We are speaking up because the California Reducing Disparity Project is ending in 2026. And CRDP has shown us what works. It has saved money, prevent crisis, and improved mental health for BIPOC and LGBTQ communities. Thank you.
Thank you. That was our last public comment.
Thank you. Now that public comments closed, we would like to take a roll call for a vote for this committee to recommend the full commission approve the RFP outline. I would like to remind everyone that our committee is advisory in nature, so this vote is a symbolic agreement that we support using this decision-making framework. So now I would like to entertain the motion that the Client, Family, and Community Inclusion, Lived Experience, and Diversity Advisory Committee recommends that the full commission approve the Innovation Partnership Fund RFP outline. Do I have will I have someone move for first?
Aye.
Thank you, Eugene. Is there a second?
Second.
We have a motion and a second to recommend that the full commission approve the Innovation Partnership Fund RFP outline. Are there any additional questions or comments from the committee members at this time? I know we got a lot of feedback, so if you have any other questions, I would hope that you can email it to us. Seeing that there's no more comments from the committee or the public, Krisanji, can you please call the roll?
Yes, could you clarify for me the committee member that seconded the motion, just so I can record it for
It's
posterity?
Richard Zaldivar.
Thank you.
Uh-huh.
Committee member Admasu.
Aye.
Committee member Ayala.
Carolina.
I'm sorry, it cut out.
Was that you were voting on
Yes.
this? Okay.
Thank you. Committee member Chavez, marking absent. Committee member Dura.
Yeah.
Committee member Gansweg.
Yes.
Committee member Gilmer, marking absent. Committee member Kayali, marking absent. Committee member Kachanovsky.
Aye.
Thank you. Committee member McFetter, marking absent. Committee member Novotny, marking absent. Committee member Owen.
Yes.
Committee member Robeson.
Yes.
Committee member Xiong, marking absent. Committee member Zaldivar.
Yes.
Committee vice chair Alvarez.
I think she
Committee- Might be AFK.
on another device.
Oh, is she?
She was having some device.
Okay. Marking absent for this vote. Committee chair Chambers.
Aye.
Motion passes.
Thank you. All right, now to item number 6. Item number 6 is the update of the peer respite request for proposal outline. This item will provide information on the proposal for how the commission can invest $20 million in Mental Health Wellness Act funds to promote and expand peer respites across our great state. The proposal splits funding into 2 phases. One focused on building capacity and the other on implementation, with research and evaluation integrated into each phase. The committee will vote to recommend that the full commission approve these options for investing the mental health wellness funds in peer respite. If adopted, the proposal will go to the full commission in January 2026 for approval, with the tentative RFP date released in March 2026. At this time, I would like to invite the Honorable Courtney Ackerman, research scientist, to present an update. Welcome, Courtney, and please go ahead.
Thank you, Chair Chambers. Happy to be here. And I know we are running short on time, so I will try to be quick. So my name is Courtney Ackerman. I'm a research scientist with the Research Evaluation and Programs Division, and I am here to talk about the Peer Respite funding outline. So our goal today is to share the outline for appropriating $20 million in Mental Health Wellness Act or MHWA funds for Peer Respite. As a refresher for the newer committee members who may not know, California's Mental Health Wellness Act grant program provides $20 million each year to improve community response to people facing behavioral health crises. These grants enable crisis responders to connect to those in crisis with wellness, resiliency, and recovery-oriented programs that offer the least restrictive settings appropriate for their needs. The Commission has administered MHWA funds according to 6 priority areas. First, empath units as alternatives to emergency departments. 2, programming for older adults, including PEARLS and AgeWise. 3, the 0 to 5 population through the Maternal Behavioral Health and 0 to 5 grants. 4, access to addiction services through a substance use disorder pilot program to increase access to medications for addiction treatment. 5, technical assistance to build capacity and improve service delivery in county full service partnerships. And 6, Peer Respite. So on to the Peer Respite project. We are defining Peer Respite as a temporary residence offering peer support services provided 24/7 in a home-like setting, staffed and operated entirely by peers. Now, this definition is a little bit fuzzy, but we're using the definition of a pure peer respite as defined by national experts. And there's an emphasis here on the entirely by peers part of the definition. This is guided by the intentional peer support model, not the medical or clinical model. Stays are generally 7 to 14 days with extensions possible up to 30 days. And peer support specialists there offer linkage to services, skill development, and just general advice and support. Peer respites have been described as guests and staff as a place where people can go to pause or take a breath. And this chance to take a break can give someone the space they need to rest and find community resources to help them function better in their daily life rather than needing to be hospitalized. So this project prioritized community engagement, including interviews with over 40 experts, peer respite operators, county behavioral health staff, and peers, a few of which are actually on this call and on this committee. So thank you again for your time on this. We also did 7 site visits to peer respites operating in California. We conducted a literature review and a landscape analysis to see what the research base was like. And we communicated with 58 out of the 59 California behavioral health jurisdictions, as well as 11 peer-run organizations in California to talk about peer respite. So speaking of those site visits, these were the 7 sites that we visited. These visits were really impactful for attendees, and I'm sure Chair Chambers can talk a little bit more about that if we have time. But they showed us how much really dedicated peers can do with very little. Each site provides the same warm welcome, support from empathetic staff, but each site did things a little bit differently to meet their community's unique needs. But meet them they did. Peer respite serve those who are struggling with severe mental illness, substance use, and/or a risk of homelessness. And they do that very well, but they don't just do that. Peer respite should be understood within the context of the larger behavioral health continuum. So not only do they serve those who are struggling, they also cut costs through reducing hospitalization and increasing linkage to lower levels of care. They're not really standalone given their impact across the behavioral health system. Some county staff also said that they act as an engagement tool for full service partnerships and other county offered care. And finally, they also employ peers via a well-established guest to staff pipeline. So peer respites fill multiple gaps and they meet needs, and they do it all at a lower cost and a less restrictive level of care. So the peer respite model is promising, as we learned, but uptake of this model has been slow for a variety of reasons. First, peer respites are an emerging practice with promising evidence, but with so few in operation, there isn't a really strong research foundation yet. Second, some peer-run organizations, or PROs, don't have the capacity yet to bill Medi-Cal for services, which is likely to be the most sustainable funding structure for peer respites. Third, the absence of partnerships. Some county behavioral health departments have not yet built relationships with PROs in their community who can provide the kinds of services a peer respite requires. And finally, there is a knowledge gap. County behavioral health departments are largely not aware of the ins and outs of operating a peer respite, nor are they always aware of its potential for filling the gaps. However, peer-run organizations in California received a recent capacity boost through the PWI and EPIC grants from the Behavioral Health Workforce Development Initiative, and they are largely ready to tackle peer respite. So California is currently making investments in peer respite infrastructure through the BCHIP grants, but infrastructure funding alone is not enough. We also need to scale up and disseminate the best practices around peer respite. And through this project, we've learned some of the best practices for making peer respites run smoothly. So peer respites succeed when the environment is home-like and welcoming, when they are led and staffed entirely by peers, when they have strong ties with county behavioral health and other community-based organizations offering services, when they're governed by strong policies and procedures, when there's a system in place for collecting data and for monitoring outcomes, and when they are sustained by braided long-term funding. So now that we know how peer respites work best, that brings us to funding decisions. So what we are proposing is a two-phase funding outline. So the first phase would invest $10 million into establishing a pilot project and a learning collaborative focused on peer respite. Phase 2 would invest the remaining $10 million into tailored funding for new and existing peer respites to meet their unique needs, along with supporting the continuing learning collaborative. So going into a little bit more detail on phase 1, the pilot project would be between interested counties and a peer-run organization within their community, and it would encourage partnership. It would provide technical assistance from our subject matter expert on partnership development, business planning, securing sustainable funding, and any other best practices in peer respite. The Learning Collaborative would be on establishing and sustaining an integrated peer respite, and that would be open to any county or PRO that was interested, not just those from the pilot project. And finally, research and evaluation would be paired with this step. So on timing, we're projected to release the RFP in spring 2026, and the funding would come from the MHWA fiscal year 2025-26 funds. So that is $10 million that needs to be encumbered by June 30th, 2027, expiring June 30th, 2029. And for a deeper dive into phase 2, phase 2 would offer tailored funding to new and existing peer respites to meet their unique needs.
Hey, Court.
Yeah. Oh, you're muted, Rachel.
Stop at 4, and we got to take a vote. So I want you can finish. This is the important last slide, I hope.
Yeah, I only have about 30 seconds left.
All right, go.
Yeah. All right. The Learning Collaborative would also continue in this phase along with research and evaluation. So this is projected to be released in spring 2028 with MHWA 26-27 funds. That's $10 million that needs to be encumbered by June 30th, 28, expiring June 30th, 2030. So for today, our discussion should be around whether there's any questions, if there's any feedback on this proposed plan, any other thoughts on the funding outline. And our next steps will be to adjust the outline based on any feedback from today and then present it to the commission next month. So I will turn it back to you, Chair Chambers.
Thank you, Courtney. And I would encourage, because I hope folks, committee members, if they do have comments, to briefly make them within like 30 to 20 seconds and submit them in writing immediately. But is there any questions or comments on this from the committee members? Seeing none, I would like to open the floor to the public to open the dialogue. We're gonna put it to. Oh, go ahead, Jason. Go ahead.
Sorry, thanks. So are you looking for?
But we have. I'm just letting you know, we have 6 minutes. This will be carried on if we don't take a vote on this, and we will not be able. So go ahead, Jason. Go. Just know that we have 6 minutes to take a vote.
Would applications have to come from counties and peer respite or peer run organizations together, or could a peer run organization submit one without a county partner?
I think that we can, Courtney can respond to that in writing, and we can follow up in writing.
Sure. I mean, our thought just very quickly is that it would be a partnership. It would need to be a partnership to work.
It sounds like, even though I wasn't involved in the creation of this, like what we did see is that people need to work together. Like it's a new thing. So I don't think it's going to work, anyone working alone. And we need to get this research so that it disseminated so more people can do it. So this is definitely going to be a build for you to disseminate, like Carolina was saying, like, and get all the information out. So we can, yeah, go ahead. So now that there's no other committee members, open it up to the public. Mariani, please open the floor up to the public.
Okay, we currently have a comment from Stacy. Your line's open.
Yes, Stacy Hiramoto Remco. We strongly support moving forward with this peer respite proposal. Peer respite has been, in my mind, been around and been so effective for so long. I just ask that in the proposal that the applicants should be required to collect demographic data, including race, ethnicity, and whether they are serving non-English speaking people. Thank you, but good luck.
Thank you, Stacy. I really appreciate the feedback. Now that the public comment is closed, I would like to entertain a motion that the Client and Family Community Inclusion Lived Experience Diversity and Advisory Committee recommends that the full commission approve the Mental Health Wellness Act Peer Respite Project outline. Do I have a first on this motion?
Motion.
Jason, I'll move.
Thank you, Jason. Can I get a second? Who's
I
that?
second. It's
I
Richard
second.
Zaldivar.
Thank you. Now that we have a motion and a second to recommend the full commission approve the Mental Health Wellness Act Peer Respite Project outline, are there any questions or comments with the committee members at this time? Seeing none from the committee or the public, Prashanti, please call roll for a vote.
Committee member Admasu.
Yes.
Committee member Ayala.
Yes. Aye.
Committee member Chavez. Marking absent. Committee member Dura.
Yes.
Committee member Gansweg.
Yes.
Committee member Gilmer. Marking absent. Committee member Kayali. Marking absent. Committee member Kachis. Oh, God. Sorry. I've been doing so well. Kashizanowski.
Krzyżanowski. Yes. Yes.
Thank you. Committee member McFetter. Marking absent. Committee member Novotny. Marking absent. Committee member Owen.
Yes.
Committee member Robeson.
Yes.
Committee member Xiang. Marking absent. Committee member Zaldivar.
Yes.
Committee vice chair Alvarez. Marking
Yeah.
absent for this vote. Committee chair Chambers.
Abstain.
Motion passes.
Thank you. And let's move on to the next agenda item, the adjournment. Now that we've come to the end of our meeting, thank you all to our committee members for being here today. And a huge thank you to the members, to the public, all you guys, and the staff for your thoughtful engagement. I feel, go ahead, Jace. Do you want to say something before you?
Well,
2 minutes.
Good work today, everybody. Can I make a really brief announcement?
Yes, because we had a hard stop. You have 2 minutes.
So
We have
the Behavioral Health Planning Council does the data notebook. The most recent program was Wellness and Community Recovery, Wellness and Recovery Communities, which will be funded by the federal government to the tune of $17 million for every fiscal year through 2030. And the state is thinking about using SAMHSA block grant funding to fund community and recovery communities after client-run and wellness centers disappear under BHSA. The council meets tomorrow at 3 p.m. So go to their website if you're interested in that kind of funded programming for peer-run organizations.
Is that what council is this?
It's the Behavioral Health Planning Council.
Oh, okay. Oh, thank you for that. I'll definitely get on that. Appreciate that, Jason. I really appreciate that. Our next meeting will tentatively be on February 26, 2020. It says 2025. I think it's 2026 in my notes. And we'll send out an email to the through our email distribution for more information. with that, I want to just adjourn this meeting. And once again, I'm so honored and thank you all for your time, insights, and commitment, and look forward to continuing this important work. And my lunch is done. Have a wonderful day.